attention now to a topic that I think we've seen all around us, and it's been much discussed. Vaping. It's often been viewed as a safer alternative to smoking. You've got these colorful devices. They've become ubiquitous. They are especially popular among students. In fact, a recent study by Gulf Medical University Ajman found that almost a fourth of students polled said they were e-cigarette users. But authorities and doctors in the UAE have been warning recently that what looks like an ordinary vape could also be hiding other prohibited substances. The National Campaign for Drug Enforcement has warned that other drugs concealed in e-cigarettes could make them difficult for families and schools to detect. Joining us now is Dr. Mohammed, who is pulmonology consultant at Medcare Hospital Sharjah and Medcare Royal Hospital Al Qusais in Dubai. Dr. Mohammed, thanks for joining us.
Hi, good morning. How are you?
Good, thank you. And Dr. Mohammed, as we talk about this subject matter, as a pulmonologist, first of all, what kinds of health concerns are you seeing in your practice that are being caused by vaping?
The vaping, people think it's a very innocent thing. So the teenagers especially, they start vaping from school. So the problem is that and they can hide it from the parents, teachers and everything. And it can easily lead to other substance use as also through the vaping device itself. Other than these things, these can result in chronic respiratory conditions. And sometimes something called e-cigarettes or vaping-associated lung injury, which is a little bit serious issues.
Are you seeing younger patients because some of these trends? I mean, it always has been a case that teenagers like to dabble with smoking and like to try that out. But is there any difference now with vaping and e-cigarettes versus what we've seen with traditional cigarettes?
Yes, of course. Actually, traditional cigarettes in that age group, teenage group, it's difficult for them to publicly do the traditional cigarettes. Second thing, in that age, our frontal lobe in the brain development is still happening. So the substance abuse and dependence on the chemicals are more in that age compared to older age. So the only positive part, if you can tell about vaping, is when we want to de-addict a patient, an older patients, for de-addiction, we can step down on vaping and try to go for de-addiction because some of them have less nicotine. On the other side, because why tobacco companies came up with this novel idea of vaping and e-cigarettes is that to promote smoking, because it's easy to attract teenagers with vaping and e-cigarettes and these fancy devices compared to traditional cigarettes. Then actually the addiction potential, as I told you earlier, the frontal lobe development is still coming. So the nicotine addiction or any substance addiction will be more in that age group. So they will be tempted to use more of going into traditional cigarettes. So that is how the market of cigarettes is expanding. Even all over the world, especially UAE government is trying their level best to control this by national drug enforcement to control all these things. But still, the companies, they try a way to come out of this all control to promote this one among pleasure seekers or smokers to get into vaping and then draw them to traditional cigarettes.
One of the reasons we're talking about this now is because of the recent warning from authorities and experts about a lack of awareness of what is actually inside these vapes. So for students who might be following a trend, might be looking for something different, what are the dangers in trying to get their vapes from unofficial sources or individuals who are peddling them rather than going to official sources for this?
So there is a misconception that, first of all, that vaping is just water vapors. So that is one thing. Maybe some children, they are still truly believing that. Second thing, because we all think nicotine is the one making cancer. No, nicotine is an addictive substance, one of the most potential addictive, even if you compare to morphine and such drugs. Nicotine is one of the very addictive thing. Not only that, that's not the reason here. Actually, the unauthorized vaping, they comes toluene and hydrocarbons, which are highly carcinogenic. So the people would think that only cigarettes, traditional cigarettes makes cancers and other lung diseases, or even heart conditions, the rise in heart rate, the heart attacks and all these things, which can develop in early life. And we see the trend now. The youngsters are getting even heart attack and sudden cardiac death and all these things. So all these situations are getting more, even with authorized vaping. Then please don't ask me about unauthorized. What all substances are there? nobody knows what it contains in the vaping and e-cigarettes.
Another thing we've noticed with vapes, and we were talking about this earlier, is that people smoke them indoors. They're always in the pocket, accessible. You don't have to take 10 minutes to go downstairs and go outside somewhere. How does vape addiction compare to traditional cigarette addiction? Because on the one hand, you said sometimes because of the nicotine content, you use vapes to help de-addict patients. But also, on the other hand, they're so available. When I see people who smoke vapes, they just always have it there constantly. So how would you compare the two addictions?
And absolutely true, because to show in front of the people, and they come in a very fancy devices, and even sometimes a small mobile phone shape. So it's easy to hide from parents or teachers, and it's very handy. They can use it everywhere. And so the addiction, youngsters, it leads to addiction. So in a selected elders only, what I told in the beginning, like who want to quit smoking. So as a tool, because we don't use vaping as a tool, direct tool to de-addict. We use nicotine patches, nicotine gums, and then some medications to reduce addiction. So, and one of the tool is vaping. That does never apply in the youngsters, okay? So another thing which you raised that concern that they are free to do it in indoor. There is an issue with indoor smoking. So these people, they make harm for others also, which is called passive smoking or negative smoking. So by way, for a society also it's a danger. For a person also it's a danger.
And you mentioned their passive smoking. When it comes to vapes, I think we're so aware with cigarettes. If somebody is smoking near you, you can smell it, you can see the smoke, you know to stay some distance away, perhaps stay away altogether. When it comes to vapes, you don't have those kind of signals. So what kind of secondhand risk is there if you're just around somebody who's vaping or in the same space?
Yes, correct. The secondhand smoking effect, whenever there is these hydrocarbons and toluenes are there in the vape, they almost pose similar risk like traditional cigarette. So as you told, you brought it up very nicely. So traditional cigarettes, we try to keep away the person who is sitting nearby. Here, people actually, they are tempted to sit there because sometimes it's a very like sweet smelling thing the vaping is producing. So nobody is distracted from the smell itself. So this leads on to a health risk, surely with people who are exposed to negative smoking.
And, we have received a text from one of our listeners, Cynthia, to say, before vaping was a thing, I got hired by a company here in Dubai. I loved the pay, I loved the title. But after 2 weeks, I resigned because all of my workmates were smoking. Our office smelled like cigarette smoke. No regrets. I knew I made the right decision. And it's interesting because when it comes to smoking, as you've said, there is such a risk of vapes also when it comes to secondhand smoke. Do you think that companies and offices should have some sort of policy around this because of the risk it's posing to people who don't even smoke the vapes?
Absolutely. You raise another concern because myself, I am a victim. I'm a doctor. No, I'm concerned about my patients. So there are a lot of asthmatics in my patient list. So they all suffer and they complain. They sometimes cry. Their colleagues are smoking in the office and they can't do anything about it. Even they complain, nothing happens, and the smoke circulates through the AC, and their asthma getting worsened. And so they don't want to take a sick leave or something like that, but they are forced to take sick leave, and they have to take more medications to control this one. These medications lead to side effects like steroids and all these things. So it poses a big risk. So I would like to request that the listener, I appreciate her. She left the job there in 2 weeks because if you continue there are health risks for the co-workers and whoever is smoking there. A group of people are smoking and they are very powerful, and other person who's a victim, their health is deteriorating. So it's an absolute reality in a lot of offices, and there should be a strict law enforcement on that sense that nobody should smoke somewhere near the office because another person is suffering because of that.
Dr. Mohammed, thank you so much for joining us and clarifying some of these issues around vapes that we're seeing.
Thank you so much for the opportunity. Thank you. Bye-bye.
That is Dr. Mohammed Harris, who is a pulmonology consultant at Medcare Hospital Sharjah and Medcare Royal Hospital Al Qusais in Dubai.